you think of postpartum depression, we have to start with like this weepy period, the first 2 weeks after having your baby. I think there's like a lot of grieving and mourning. And so it's normal to be like weepy for these first 2 weeks. And sometimes some people just feel elated the whole time, and that's okay too. So postpartum depression, it like happens well after that 2-week period. Postpartum depression, it's like that lack and that desire of wanting to take care of your baby sometimes, and sometimes there's those thoughts of like harming yourself or your baby or other people around you. Postpartum depression is hard, like all in all, it's really hard. Having depression on an everyday basis is hard, but like taking care of someone while having depression is like a whole different ball game. It's complex, it's very complex. You know, we all know what depression is. So it's just that, but intensified because there's also like adding a baby in the midst of it, and then throw all these hormones that you're still coming off of in the midst of it. And it's just very much so, like you can't get on top of anything. Usually there's some pre-existing factors, like if you've already had a history of depression, and there's a lot of grieving and mourning of like old self, right? Especially if you weren't prepared or ready to have a baby or add a new member to your family. So it's like, it can be a combination of things. If you've already had that pre-existing depression, just adding another member to the family and mourning your old self and your old body and that loss of who you were before, that it can occur because of that. There's various reasons, situational, circumstantial. A lot of the ones that I see are very situational. So very much so like they don't like their partner, or their life isn't where they wanted it to be when they had a baby, or they just weren't ready for a baby. Throughout the postpartum period, we screen for postpartum depression. We use what we call is an Edinburgh postpartum depression scale. And just getting to know your patients prenatally helps too. So seeing what is normal for their mood and affect, and then what's not normal for their mood and affect. But that postpartum depression screening, it really helps as well. There is so much that we can do as care providers. So it's like we need a specialist. So maybe we recommend seeing a therapist or suggesting that they go to therapy for what they're experiencing or dealing with. And we talk about it, like there's a lot of exchange throughout the postpartum period between the midwife and the patient. So we discuss it as well.